Dr. Shikanga, please take the podium. Members, I would like your attention. We're going to begin with a word from a representative of government of Uganda, Dr. Issa Makumbi, to welcome the external team representative to give us a brief on what has been happening throughout the week. Thank you.
Thank you, our moderator. My name is Issa Makumbi from the Public Emergency Operations Center. We want to welcome our partners here who are seated with us, and we hope some are still on the way. But I think let us start. My duty here is to tell you why you are here, and so that we can deliver to you why we are. I'm sure everybody has a program. We have been doing what they call joint external evaluation. This is a process where a country assesses its capacity according to the International Health Regulations 2005. Each country can voluntarily conduct or undertake this exercise to make sure that they identify critical gaps in their health security of the country, and in particular, compliance to the international health regulations, which is legally binding to all 196 states which subscribe to this international treaty. So Uganda is one of them, and we voluntarily requested WHO to send us an independent expert team to come and assess us to see where we are in complying with international health regulation. And we did apply to WHO in April, and in May we started the process of planning. It's quite a process, very intensive process, interacting with WHO and all the stakeholders. This compliance to IHR requires that all whole of government approach, whole of society approach. So one of the first phase of this exercise is to conduct an internal national assessment of capacities. But these capacities must be contributed to by all ministries or relevant ministries, departments, agencies. And this is exactly what happened when we did our internal assessment. We were in the same room here last month. We had all the relevant MDAs. I don't think I'll mention their names now because of time, but we had the private sector, we had civil society organizations, we had academia, we had partners, we had implementing partners, and we had health consumer association. So it was really a broad range of stakeholders who came here to assess the national capacity. After the internal capacity assessment, multi-sectoral, whole of government and whole of society, the report was sent to WHO, which the external team reviewed and came here to verify whether what we assessed is what on the ground. So since Monday, we have been assessing the capacity according to the tool called the JEE tool. It has 19 technical areas. And these 19 technical areas, they have what we call indicators. And these indicators are attributes of progress on how you build a capacity into or in a technical area. You go from 1, 2, 3, 4, up to 5. When you are at 5, that is called sustainable capacity. When you are at 4, that is developed capacity, and so on and so on. Maybe the head of the exam team maybe will throw some light on there. So really, that's what we've been doing since Monday, Tuesday, Wednesday. Thursday, we went to the field to touch the ground. The external team went to the field to touch the ground to see what is on the document is what is on the ground. And this morning, we got a feedback from the external team who visited our structures. They went to the airport, they went to our laboratories, they went to our health units, and they went also to slaughterhouses. Again, I request you that you brief the people about what you found on the ground. And of course, you gave us very good, valuable recommendation for us to improve in some of the area. But generally, the team was very impressed. What was in the document reflected very well what was on the ground. I'm sure the head of the external team, please throw some light when you get the opportunity. So today, we want now to present the results of the external eye on how the country stands as far as health security is concerned or compliance to IHR 2005. As you know, all countries have an obligation to build capacity, sustainable capacity, so that we don't transmit disease across our borders. And that's the main purpose of the international health relations, to prevent spread of disease across borders without unnecessarily interfering with traffic and trade. So that's why we are here today, to look at that assessment. And the team, we had the national experts interacting with the external experts, and both of them together built a consensus on what is on ground and agreed amicably with the status of our status as far as capacities are concerned for our health security, and made recommendations, again, which the head of the team will elaborate as we go along. So my job was to tell you how events have been evolving, and now this is the last point, or this is not the means to the end, because after this we shall be developing another plan, because we did our first Our first JEE was 2007. After 5 years, we are doing the second one, where we shall develop another plan to address the recommendation and gaps we have identified together. I thank you very much, my moderator. Thank you.
Thank you, Dr. Makumbi. We have a couple of minister representatives in the room. So if you know you've been sent by a minister to represent at this closing ceremony, there's a table reserved for you right here. So kindly make your way to the minister's table here. Thank you. Dr. Shikanga, sorry. Please take the floor. Sorry for butchering your name.
Thank you so much, moderator. These names are not always easy. Now, representative from the Prime Minister's office, heads of government ministries, departments, and agencies, the representative of the WHO, representative in Uganda, representatives and heads of UN and other development agencies, all protocols observed. I would like to start by most sincerely appreciating the leadership, visionary leadership of the government of the Republic of Uganda in respect to public health specifically. It's not always easy. Some of the areas where we work, it's not always given that, you know, governments will submit themselves and volunteer to undergo this process. And therefore, from WHO, from the external team of evaluators, we express our utmost gratitude and appreciation for the leadership of this country and for the Ministry of Health for volunteering to undergo this process. Now, Dr. Makumbi, thank you so much. I would have wanted to say some things to set the background, but I see you've said most of them. So I'll try save on time, but just let us appreciate the necessity of the global, regional, and country opportunity to sift through the ashes of public health, pandemics, emergencies, events that we go through, to see if there is anything in there that we can learn to let our populations live in a much healthier environment, assuring everyone of utmost health at any one moment in time. And I will just point out on the necessity, the international health regulations, which has been a work of the World Health Organization, not alone, but strongly partnering with other organizations at the international stage, the US government agencies and the other international organizations, and most importantly, with the leadership of member states through the World Health Assembly and the different kinds of boards and administrative structures that have been set up by the World Health Assembly that give direction and guidance on, the leadership that WHO needs to take to assure the global community of health security. We have had the international health regulations since 2007, fully in implementation. We ran through the initial years of implementation where countries were assessing themselves. I remember initially after every 2 years, but later on after every year, up till 2014, when Ebola struck in West Africa, and countries that had been assessing themselves quite stable virtually collapsed. The health sectors collapsed. Other sectors of the economies and society collapsed. And it was an awakening moment when we could sift through the ashes of that event to learn that the assessments that we have been conducting over time may not be objective enough and may not be serving the purpose for which they were set. Hence, then the need to, and the recommendation that countries move from just self-assessment alone to a method where countries will assess themselves and thereafter subject themselves to the JEE process by having the external team of evaluators come in to peer review the findings of the country to ensure that they are objective, in place, and functioning. And so we are happy that Uganda submitted itself to undergo this process for the second time, and hence our coming in following this invitation. Now, as Dr. Makumbi has presented, we have gone through a rigorous process of, consensus seeking since Monday, where the country teams across the 19 technical areas and 56 indicators have presented findings of the internal assessment, and we have, within this friendly environment, at times quite heightened, attained consensus on the scores of where the country is per indicator, and also worked with the country to identify critical priority actions that need to be put in place to move the country towards, a perfect state, however elusive it has been in the past, a perfect state of health security for everyone in this country, and also to help the country to contribute to global health security. And so following this, we have finished this work. We have a draft report in place, which we shall not share with you yet, but I'm going to present a summary of that process, that just to let you understand, mainly in 3 parts. First, just to understand who the team members are, and if you could, whoever is pushing the slides, if you could push in slide number 3, please, for you to understand the team of external evaluators that has interfaced with our counterparts from the country. And number 3. And secondly, just a summary of some sort of executive summary of the key findings of where we are, our areas of strength, not quite exhaustive, but capturing the key areas of strength that we picked up, and also some areas that we may need to work on generally. And again, it's not exhaustive. Then finally, taking you through the summary scores and closing up with the way forward. But just a caveat here that Uganda has been baptized through fire. You have had emergencies before. And so you have one of the best systems on the continent in terms of, preparedness, prevention, preparedness, detection, and response. And we know that we have a very strong partnership in this country that some countries actually admire. And so if you see a red, if you see a yellow, which is limited capacity, it is not an indictment on what we haven't done in the country. Because we have done a lot, and in 1 week sitting, we cannot trash what the government, the ministry, and your partnerships have done in the country. And so we take this positively as an objective way of looking at the few lower end areas that we need to focus on to try and uniformly push up our capacities to secure the health of Ugandans. And so you will see there a list of the external evaluators. We are 14 from a number of international organizations, WHO Afro Regional Office, WHO country offices, a number of WHO country offices, from the USID, from ministries of health of some of the countries on the continent, from international organizations like Resolve to Save Lives, from FAO, the UN Food and Agricultural Organization, from Africa CDC, a celebrated continental organization that has more political reach than some of the organizations that we work in. We have independent consultants who are with us to oversee the process. And yes, and someone to help us documenting the report. Next slide, please. And so in 2 slides, I'll just summarize the strengths. In the next slide, I'll just summarize some of the strengths in the next 2 slides that we have picked up, including the recognition that the country has a robust legislative framework that is aligned with international and regional legal frameworks. Legal mapping was done in the country in 2017. That was followed by revision of a number of legal instruments, and some statutory instruments have also been put in place, although some of them are still in the process, but almost nearing completion, which is quite good. We have a strong institutional arrangement in place on gender considerations, and this for Uganda was put in place long before we even started putting this much emphasis on gender considerations in health security. We also have a clear structured planning and budgeting cycle, bottom to up, with a clear cycle that is guided by the National Planning Authority, and that ministries, departments, and agencies of the government develop their annual budgets that are linked to or reflect or go into the 5-year National Development Plan, and at the moment the country is using NDP3. We also recognize that the IHR National Focal Person is anchored and integrated into the government structure, and that various MDAs, ministries, departments, and agencies have nominated liaison IHR focal persons in those areas, although like you will see later on, we still have to do quite a bit to make these structures mature up. And then we have a national antimicrobial resistance action plan with a broad stakeholder involvement in development and also early implementation stages, and that there exists a national One Health operational plan with decentralization of One Health that's subnationally, that's below the national level, quite catching up quite well at the intermediate level, but also with movement to lower levels than that. Next slide. Surveillance for food safety issues is already ongoing through events-based surveillance as a component of integrated disease surveillance and response. Although, again, we have provided advice on ensuring that a standalone, mature, but plugged into other systems and sharing information across is established. There is a multi-sectoral participation in the development and domestication of policies, guidelines, and several of them have already been developed and are in place. Uganda has a strong health system that supports the immunization program. And may I just point out that out of the 56 indicators, we got only 1 5 for the country, and 5 is the utmost best. And that 5 came from immunization, which talks of an immunization program that is well-grounded, that is well operational, routinely, and whenever we have public health events, with the availability of a health workforce to deliver integrated health services and a strong development partner engagement and partnership. And over this, again, we would like to most sincerely thank the partners in the House and partners who support the country's immunization program. Overall, Uganda has a strong laboratory services across the One Health landscape. Although, again, like you will see later on, there are still areas for improvement. Uganda has adopted the 3rd edition IDSR, with both indicator-based surveillance and events-based surveillance in place. And they're also using electronic tools, which makes work quite easy and work-friendly for the people who are supposed to perform the functions. And quite notably also, there is ongoing reporting from both private and public facilities. It does not always work like this everywhere. Most places you'll find it's reporting from government facilities, but not from private facilities. But for here, we are happy that reporting is across board, covering both private and public facilities. And like I said earlier on, having been baptized by fire, and I believe it's from Gulu or some years back around 2000, Uganda's capacity for health emergency response is in no doubt. With available platforms, plans, human resources, and other ingredients required for, for health emergency response. And so there are many things, and you're going to see them in the report. But I will also just want to mention a couple of things that are areas where we need to focus our energies for improvement in days to come. Like I mentioned, mapping of the legal landscape was done in 2017, and a lot has happened, but the Animal Health Act is not yet fully revised. It's in process, and the process advanced. So we urge that you focus on having this process completed and the bill moved from a bill to an act that is going to drive this area. We also need to strengthen the infrastructure to facilitate enforcement of laws. We learned that, yes, we have laws in place. We have SI, statutory instruments, whenever we need them. But we have a bit of challenges in deploying this when we have emergencies, enforcement. And therefore, working with all other relevant government agencies, we need to look at better ways of having this enforced when we have emergencies. We also need to strive for better planning, budgeting, and financing for the international health regulations implementation, especially so in the other centers outside human health. Human health is functioning much better. Yeah, but we need to provide as much energy and focus on the other sectors. The IHR concept has not been fully appreciated and institutionalized by some ministries, departments, and agencies. And so for those who are represented here, please let us make this a priority so that everyone is bringing their fair share of contribution to health security on the table. AMR is not well represented or institutionalized in the national One Health platform, with lack of formal coordination points in some of the MDS, which again is an area of focus. We need to move forward and operationalize data sharing and information exchange beyond ad hoc arrangements. Ad hoc arrangements won't do. They can serve us for now, but as long as we are not institutionalizing this, we are not guaranteed that they will remain there and serve us in perfection and in the long term. Legislation, regulations, standards, and national food safety policy are required, policies that are required. And this is likely to also address the disjointed mandates by different agencies. We have different agencies doing a lot of things, but the efforts are all disjointed. We have a situation of a 1 + 1 = 3 if we can work through the entire process. For biosafety and biosecurity, we need to review legislation to address the rapid advancement in biotechnology and threats that were not previously considered. And also we need to superintend this area much better than we are doing at the moment. It's an area that's going to be increasingly more important moving forward internationally. Then we also recommend that the country should address utilization of immunization services. They scored the only 5, but they still have weaknesses in other areas. For instance, in the 2022 Demographic and Health Survey, we learned that only 54% of children received all basic vaccines, meaning there is still a lot of room for improvement. The National Laboratory Diagnostic Systems is also still highly donor funded, often with limited resources to strengthen capacity in the non-human health sectors. And so this is an area where, by first intention, government could go in and stabilize the functioning and not start increasing its contribution to sustaining laboratory services. In itself, it's assured health security. The country should complete cascading the 3rd edition IDSR to all levels and seek better ways of systematizing data and information sharing across sectors. Finally, our men, not finally for everything, finally for this session, our men in uniforms in this country are some of the most troubled and therefore quite exposed to public health risks. Yet we found out that there are still a bit of limitations in engagement between the civil and uniformed wings of public health. And so our recommendation is that we continue working together moving forward to strengthen. Let us identify what strictures may exist. Some of them are quite understandable, but let the overriding consideration ultimately be health security and address any strictures that still remain that should then enable much better coordination between the uniforms and the civilians. I will quickly move over to run through the scores. It's going to be quick. I will start with legal instruments. As you can see, the only 2 indicators scored 3 each, and the 2 priority actions. So out of the many priority actions, we are going to share only just a few, just a tip of the iceberg, but the rest are going to be in the detailed report. And so for legal instruments, we prioritize together in consultation with government the need to develop and implement a roadmap or action plan for the finalization of the Animal Diseases Bill, which is an amendment of an existing act. And that is in process, but we urge that we hasten the process. There's need to expand the legal analysis to address the other IHR-related technical areas, which were not covered in the initial 2017 analysis. Financing has a 3 out of 5 is best, 1 is least. So financing, the first indicator has a 3, the second indicator has a 2. And the priority actions that we need to train our HR focal points on advocacy, communication, and resource mobilization. We need to up our game in resource mobilization. The slides, please, if you could push up the slides, move over to financing. All right. Then also the ministries, departments, and agencies should establish a mechanism to rapidly access resources. It's not enough to have resources. You need to get those resources in place and moving at the right time. Next slide, which is on IHR coordination, national IHR focal point functions and advocacy. It has 3 indicators. The best indicator was at 4. The last indicator was at 2. The other indicator was at 3. And the priority actions were to create a clear legal mandate for IHR implementation in the Public Health Act, and also to conduct a needs-based training for IHR focal persons. In the next slide, on antimicrobial resistance, there are 5 indicators. 2 of the indicators were at level 3. 2 of the indicators were at level 2, 1 of the indicator was at 1, meaning no capacity. The actions thereof were to develop a clear terms of reference to operationalize multi-sectoral mechanisms for engagement for AMR, and also revise the national action plan and implement that costed plan with an integration and standardization across One Health for AMR surveillance with priority pathogens consideration. On the next slide, on zoonotic diseases, it has 3 indicators. The best indicator was at level 3. The other 2 indicators were at level 2. We prioritize putting in place a new legal framework, as the current legal framework is outdated. And remember, zoonotics is across mainly 2 sectors. And also to develop a plan to fast-track livestock identification and traceability system. In the next slide on food safety, there are 2 indicators, both of them were scored at level 2. The priority actions are to develop a food safety emergency response operational plan and to operationalize that will help to operationalize the multi-hazard plan. And also to develop a food safety communication strategy as part of the One Health communication strategy. There are many other small things that go with this, and so we are dwelling a bit more on a higher strategic level. For biosafety and biosecurity, next slide, there are 2 indicators, both of them at level 2. Biosafety is quite important. We prioritize fast-tracking the review and the passage of the legal framework for biosafety and biosecurity, and to work with the relevant MDAs to conduct a pre-service training needs assessment and develop and implement a pre-service training curriculum for inclusion in higher institutions of learning for all laboratory-based courses. In the next area, immunization, 3 indicators, the best was 5. And so that we can see if our understanding resonates with that 5. That 5 is on the indicator of mass vaccination for epidemics of VPDs. And so, all right, if it takes me a minute to be there, well, so the other 2 indicators were just a moment, please. All right, so I just want us to pinch ourselves and see if we are still alive. Mass vaccination for epidemics for VPDs. Label number 5 reads, the national plan and relevant SOPs for mass vaccination response have been applied against at least 1 epidemic of a vaccine-preventable disease in the country. National guidelines for regulatory approval and acquisition of new and experimental vaccines have been utilized in real event or simulation exercises. And the plan and SOPs are assessed, tested, and updated regularly. So we hope we were objective enough. We hope for members who are not in that team, that reflects where Uganda is. So the other 2 indicators, one was at level 4, the other one was at level 3. We prioritize introducing individual data capture to ease follow-up for complete vaccination and verification of vaccination status, and to accelerate scaling up of investment in the vaccine last mile delivery model and other innovative ways of improving delivery systems to health facilities. Next slide on national laboratory systems, 4 indicators, 2 of them at level 4, 2 of them at level 3. And this is one area that Uganda has been an authority sort of in the region. And we've seen neighboring countries utilize the facilities that you have set up. And so again, to the partnerships, what you invest in the country is not does not go in vain, but it serves the country and the neighboring countries. The priority actions are to develop an interoperable and real-time national system or platform for data sharing and reporting across the different sectors, and to establish and operationalize mandatory national licensing body for laboratories in line with the quality standards that exist. Under surveillance, there are three indicators. One of them is at 4, the other one is at 3, the other one is at 2. Surveillance, please. Next slide is surveillance. And we prioritize rolling out a country-wide multi-sectoral rapid response teams training and maintaining the database at all levels, which will contribute also to our surge capacity, and also functionalizing data analysis, integration, interpretation, and utilization at subnational levels across the different sectors. In the next slide on human resources, 4 indicators, the best at 4, the second at 3, the third one at 2, and the least performing at capacity level 1. The priorities that we present are restructuring and fast-tracking implementation to align with effective implementation of One Health, and also developing a surge plan policy and database for recruitment and deployment of health workers during public health emergencies. These should feed into the newly restructured human resources for One Health. Under health emergencies, and we have just come from the peak, where we're coming down, almost there. Health emergency management has 6 indicators, 3 of them at level 4, 3 of them at level 3. We prioritize developing a well-costed and resourced multi-hazard contingency plans for the 16 priority conditions. This country has done public health risk assessments before, and they have identified 16 priority events, disease conditions and events. And so it's only proper that we go all the way and complete the contingency plans and cost them and implement them. Then we also need to develop a health emergencies research development framework that is well resourced. Linking public health and securities has only 1 indicator, which was scored at level 2, and with priority actions of establishing a platform for multi-sectoral engagement using the One Health approach, and expediting the signing and approval of MOUs and other agreements or arrangements or protocols or SOPs to foster information sharing between the security authorities and public health. Under health services provision, which is quite cross-cutting, this is routine and in emergencies, it has 3 indicators. The best performing is at level 4, the other one is at level 3, and the least performing is at level 2. We prioritize improving healthcare financing to operationalize the health subsector. I believe there's some word missing here. Then Gordon, right? And the second priority is to fast-track the approval of the National Health Insurance Health Scheme Bill. Infection prevention and control, and this is important, although it's a new indicator. And so next slide, please, on IPC, you will see that it has quite some 2 reds. Out of the only 4 reds, 2 of them are in IPC. We prioritize collaboration with AMR, developing a national health acquired infections plan, and integrating the implementation of the same with AMR surveillance, and also finalizing a costed national IPC action plan and implementing the annual operational plans with priority activities aligned to the One Health, to the WHO plan, I think. For RCCE, only 4 slides left. For RCCE, we have 3 indicators. All the indicators were scored at level 3, with the priority actions being the using the One Health platform to advocate for RCCE to be coordinated from the office of the Prime Minister to allow for better multi-sectoral, whole of government and whole of society implementation. We also agreed on promoting and facilitating joint planning and reporting by community stakeholders on community engagement and interventions at that level. IPC is no longer, RCCE is, traversing all the way up to where our people are in the community and has a heavy, base at the community level. Points of entry, this is where IHR began. The initial thinking of IHR has 3 indicators. The second indicator is at level 4. The first and third indicator are scored at level 3 each. We prioritize operationalizing the new POE human resource structure through deployment of the required staff within 2 years, and also development and implementation of the national POE multi-sectoral strategic plan for the attainment of the required IHR core capacities at points of entry. Second last is chemical events. Chemical events is important, but it is one of those areas that don't receive much attention. So if we can attain adequate partnerships to support this area, it will advance not just our areas of interest, but also other areas of interest in the country outside human health. It has 2 indicators. Both were scored at level 2, attribute level 2. The first priority action is to develop and implement an integrated chemical intoxication and poisoning management strategic plan, and to designate and capacitate reference health facilities to handle chemical emergencies with trained healthcare workers, also with equipment and supplies in those facilities. The last technical area is on radiation emergencies, equally important, equally receiving not its fair share of attention and investment. The 2 indicators each was level 2 out of the best of 5. And the priority actions are to develop and implement a roadmap for finalization and approval of the draft. That must be a plan and regulations on monitoring of radioactivity, stock, fertilizers, and construction material, and to designate and capacitate through case management, manuals and training, equipment and supplies of health facilities to manage radiation exposures. Last slide, which is our next steps. Again, we are happy and grateful for this ample space that you have given us to be able to do what we have done this week. But moving forward, the next steps will be as follows from our end. We shall finalize the JEE report and send the report back for country comments within 2 weeks. The country will look through the report and provide suggestions for a period of 2 weeks, after which we highly request that the country shares back the report with us after 2 weeks of receiving it. Then the JEE external team will finalize the report within 1 week of receiving the comments from the country, which hopefully again should be within the month of November. And with permission from the country, WHO will publish the report on its global strategic engagements portal, where all partners, global, all partners in health security would often go to check the status of countries, the gaps that exist, and this usually then informs decisions on investment in health. Then after this, once they're published, or even using the executive summary that we are going to share first. The country can next step, because JEE is not an end in itself, but it's the beginning of the planning process. After this, we highly urge the country to move with speed and move into national action planning for health security. That is developing the national action plan for health security. Thank you so much.
Let's clap for Dr. Shikanga. Again.
Thank you. Thank you very much, Dr. Shikanga, for bringing our guests and the chief guest up to speed. As you realize, there are quite a few items remaining on the agenda. But before that, I would like to recognize the presence of our chief guest who is supposed to close this event, the representative from the Office of the Prime Minister, Dr. Aggrey Ngobi. He has been here with us for the whole week, and even today he was here early enough. So I would like to take this opportunity to request our guests to the high table. But as he does that, I request the representatives from the to accompany him to the high table, then we can actually continue with the other programs. Thank you very much. So should the head of the development partners so be part of the team to take up the high table? The director animal resources as well. Thank you very much. When you look at the program, we are supposed to have a communication from the head of development partners, who happens to be the chair, and from UNICEF. May I take this opportunity therefore, maybe as we give our guests time to settle in, the cameraman, I'll request you to do your job a little bit faster. Make sure you don't provide an overdose of photographs. So So thank you very much. I would like to go by the program to request the head or the chair of all development partners to give her speech. You're welcome.
Thank you very much. Our chief guest, representative of the Prime Minister, representative of the Honorable Minister of Health, Director and Animal Resources, Head of Mission, USAID, representative of the World Health Organization, distinguished delegates, ladies and gentlemen. I'm honored to address the meeting on behalf of the Health Development Partners, the Health Development Partners Group. I wish to underscore the critical role of international health regulations in preventing health emergencies and how harnessing regulations can significantly improve population health. Uganda's decision to volunteer and undertake this joint external evaluation is a testament to the commitment of the government of Uganda and the priority given by the country for a comprehensive preparedness and response to health emergencies. As I just noted, we can't overemphasize the importance of international health regulations for preventing health emergencies. The IHR framework is here as a linchpin in global health security. We note that by adhering to these regulations, countries strengthen their ability to detect, respond to, and mitigate the impact of public health threats. We have learned again and again that health threats do not respect borders and cross between humans and animals. The IHR framework facilitates international collaboration, data sharing, and mutual assistance, fostering a more coordinated and effective global response, as we have been doing through the week. The IHR again can be harnessed to improve population health in general, because compliance with the regulation can drive essential improvements in the national health system. It encourages investments in healthcare infrastructure, workforce development, service delivery, thereby enhancing the health system strengthening and overall population health. It emphasizes the importance of early detection and rapid response, principles that can be extended to routine health care, enabling better preventive health measures. Moreover, a robust compliant surveillance system provides valuable data for disease tracking. Leveraging this data can lead to evidence-based decision-making and targeted interventions to improve public health outcomes. I believe we do have low-hanging fruits for preparedness in Uganda, including the prioritization of community health and health promotion, brought even forward by the recent launch of the community health strategy. Empowering communities with the knowledge and tools to prevent and manage common health threats. Effective community engagement can significantly reduce the spread of diseases. A wide-ranging investment on digital health solution is another point. Leveraging digital technology for real-time data sharing, telemedicine, and contact tracing, which can all expedite responses to health emergencies. We also see a growing recognition of the role of public-private partnership, foster collaboration between the public and the private healthcare sectors to expand capacity, improve access to healthcare resources. The One Health platform and approach that the country is implementing brings together all relevant sector ministries of the government for pandemic preparedness and response. It will also continue to play its crucial role in the effort. One thing that we all now know is the intertwining between animal health, human well-being, and the environment. Strengthening the One Health platform is an important undertaking we need to support to make sure that we have a healthy environment for human beings and animals, and also handle emergency preparedness holistically. Using this opportunity, I would like to request the coordination team for the One Health platform to facilitate a deep dive of the recent submission of Uganda to the Pandemic Fund and critically analyze its proposal and prepare better to position Uganda for future similar opportunities. Uganda can start with these low-hanging fruits and a number of other enabling situations, including successful outbreak control experiences we have for a number of times, to build a stronger foundation for health security with a focus on sustained efforts, one, to strengthen surveillance and early warning systems, to ensure timely detection and reporting of potential outbreaks, thereby facilitating swift responses, and two, to focus on health workforce capacity building, and of course, to maintain strategic stockpile of essential medical supplies. Dedicated funding for preparedness activities as part of the overall public health budget will be crucial to enable these preparedness efforts sustainably. In closing, we again acclaim the government for a proactive adoption of IHR and the joint external evaluation to not only safeguard public health, but also reinforce the foundations for a resilient healthcare system. As we confront the current challenges and uncertainties, we must always prepare today for future pandemics and public health emergencies. The Health Development Partners Group, alongside our collaborative efforts, remains committed to working closely with the government of Uganda to enhance preparedness and secure healthier future for all in Uganda. I thank you.
Thank you very much, the Chair of the Development Partners, for those brief remarks. Dear Chief Guest, ladies and gentlemen, you realize that we have quite a number of actors playing a role in global health security. At this juncture, I would like to call one of our implementing partners, that is the Food and Agriculture Organization of the United Nations, to give us some brief comments. So the representative of FAO, please, the floor is yours.
Thank you so much. The Prime Minister, representative of all the ministries, the permanent secretaries, the external assessment team, the directors, commissioners present, all the partners, and to the rest of us, protocol observed. I'm Alice Namatovu. I'm speaking on behalf of Dr. Antonio Querido, the Food and Agriculture Organization country representative. I would like to thank the organizers for the opportunity given to us. And it's with great pleasure that we are part of this closing ceremony. This is in line with the FAO Global Strategic Framework 2022-2031 in support of Agenda 2030. And this allows us to promote transformation of the agro-food systems to be more efficient, inclusive, resilient, and sustainable. And this helps us attain the 4 betas for Food and Agriculture Organization. That is, better production, better nutrition, better environment, and better life. So these public health emergencies, they have a negative implication to our four betters. And based on that, FAO supported the development of the One Health Strategic Action Plan of 2011, whose main objective is on food and health security. So we are able to attain this through strengthening veterinary and animal production systems. This enables us to have better monitoring of disease threats and care for animal and environmental health. So these public health emergencies, we are aware that most of them are coming from the animal side. And for us to tackle them, it requires us to strengthen disease surveillance, to understand the epidemiology on the animal side, to build capacities, enforce safe animal production, and veterinary infrastructure. So FAO is able to do this through bringing on board expertise and also promoting the legal framework. So with this background, ladies and gentlemen, allow me to thank the government of Uganda for having taken this bold step to undertake the second JEE. I would also like to thank all the MDS who have been actively engaged in this process. I would thank WHO for having taken lead into this process, and for all the development partners who supported the recommendation of JEE1 to be able to attain the scores we are celebrating now, and also those who have supported the process for this second JEE. As I conclude my remarks, FAO pledges to support the multi-sectoral approach, and it pledges to support the government of Uganda through MAIF and also the National One Health Platform to support the implementation of most of the recommendations from the animal side. And it calls upon other UN agencies and partners to work together to ensure that we support this cause, particularly on the nodes where weaknesses were evidenced in this assessment, if we are to raise our scores come the third JEE. So with that, I would like to conclude, and thank you so much for listening to me.
Thank you very much, the representative from FAO. Let me take this opportunity. We are moving a little bit fast because you know today is a Friday. So let me take this opportunity to welcome the representative of the WHO, that is Dr. Jonas Tegeneth.
The chief guest, representative of the Right Honorable Prime Minister, the representative of the Honorable Minister of Health, the chairperson of the development partners, the USAID mission director, representatives of development and implementing partners, representatives of government agencies, invited guests, ladies and gentlemen, good afternoon. Before I proceed, allow me to convey apologies from Dr. Jonas, the representative of the World Health Organization, who is not in country at the moment. So I'll be standing in for him, and I'll make these remarks on his behalf. So allow me to start by appreciating the Office of the Prime Minister for mobilizing stakeholders to address issues of global health security. I commend you for the multi-sectoral approach that has been taken to realize the goals in global health security and also the goals of this particular exercise that we are undertaking. This week has really marked a critical step in strengthening of health security in Uganda and also in the region. For the last 5 days, we've had a team of external assessors, experts in the various areas who have really engaged critically with the country teams to build consensus with regards to the capacities of the country to prevent, detect, and rapidly respond to public health risks. During this process, the teams have been able to identify the most critical gaps within the broader health systems with the aim of prioritizing actions that are to be taken to enhance preparedness and response capacities in the country. This particular JEE happens at a time when the country have just responded to two major events, that is COVID-19 and EVD. And we believe that the investments that were put during these two major responses have contributed to the great achievements that we have observed in this exercise. We saw the presentation of the achievements that were highlighted by the lead of the external assessors. Most importantly, this JEE exercise has enabled us to achieve the following. And as I talk of JEE exercise, I talk of the whole process. We know this was the process where we were building consensus. We've had two other exercises that have been undertaken. That includes the internal assessment, and also there were visits to the ministries, departments, and agencies that are implementing the National Action Plan for Health Security. So when I talk of this, I'm talking of all that up to the level that we are now. So when I look at that, we've been able to determine the progress that has been made since 2017. The previous NAFS is expiring. The National Action Plan for Health Security is coming to an end this year. So through those processes, again, progress has been documented. And this serves as a stepping stone to improve further. Again, through all these processes, now we've come to a level where we've built consensus on what the scores are over all the different 19 technical areas. Again, through all these processes, we've been able to identify the strengths, the best practices, the areas that require improvement, and also the priority actions that need to be implemented to take us to another level. Again, through all these processes, there have been engagement with various stakeholders, and this has fostered partnerships and also collaboration such that moving forward becomes easier. Again, this has also enhanced the multi-sectoral collaboration and networking, and enhanced also stakeholders' awareness on the health security issues. And most importantly, because we've been discussing together, you've engaged through all this, we are all aware now of the gaps that exist in the different sectors, which makes it again easier to move forward jointly and also to prioritize efforts and resources towards addressing this. Why was I talking about all these achievements? When I look at it, this shows that we are actually ready for the development of the National Action Plan for Health Security. We have everything that is required. And as the team leader of the external assessment team was talking, he highlighted that there is a need to hit the iron while it's still hot. This also came out through the sentiments of the Director General in the opening remarks. We have everything. And therefore, let's not lose the momentum. Let us immediately move to the next step, which is developing this National Action Plan for Health Security, and move forward also with mobilizing resources towards its implementation. We look up to the leadership and commitment by the government of Uganda, and we urge partners to contribute to addressing these most critical gaps that have been identified. Ladies and gentlemen, as we end this meeting and also the entire JEE process, I would like to commend the efforts and dedication of all the personnel at all levels of the health system. They may not be here, but their roles have been critical to get us to the level where we are now. And we also appreciate that as the teams moved out to see what is happening, they were able also to establish that what was discussed here was actually the situation also on the ground. So we really want to appreciate them. And without them and all these other people in these levels, we will not really make adequate progress. I also particularly want to honor the different communities, because we know that engaging with them and working with them is also part of ensuring that we accelerate the results that we are looking for. When I look around, even as we conclude, I was just trying to imagine the architecture of the health security and all the players involved at all levels of the system. It is so diverse. And this diversity can either be a strength or can be a weakness depending on how we look at it. So I want to urge all of us that as we live here, let's look at this diversity with the ladders lying down. If the ladder is standing, it shows like one level or one person is higher than another. But if the ladder is lying down, it shows the different uniquenesses and the strength that the different players bring into this field to ensure that we attain what we are working towards. So I want to urge all of us, all the different players, let us look at our diversity as a ladder lying down. Then we are able to look for the uniqueness and strength that will push us forward to achieving this agenda, to enhancing health security in the country and also beyond. WHO is committed to support Uganda and also forge strong partnerships and to intensify these efforts that are already in place and to meet the demands and challenges of the public health threats that we have constantly as Uganda been facing. And as I conclude, I just want to appreciate everyone. It has been one response after another, but we appreciate all the teams, and most importantly, for the efforts that were put in place in the last response for Ebola virus disease, which was controlled in record time of 69 days. Thank you very much. We appreciate you all and honor all your contributions in this. Thank you.
Thank you very much, the representative of the World Health Organization in Uganda. We recognize the contributions of the different partners. I know we may not have had time for everyone because, as I mentioned earlier, in global health security, we have quite a number of IPs, even in this exercise. I didn't know the importance of recognition until I heard this story. Somebody did a very great favor for the king, one of the subjects. The king was so pleased. Then he said, choose anything that you want me to do for you. I don't know what each one of us would have chosen. A Mercedes Benz? So this subject told the king, wherever you are, whatever function you attend, just mention my name. So the other IPs, we promise we may not have given you time to give us a speech, but wherever we shall be, we shall always mention your names. Thank you very much. If you look at the program, we have remarks by the Minister of Health, who is represented by our dear Commissioner of Integrated Epidemiology, Surveillance and Public Health Emergencies, Dr. Alan Muruta. Honorable Minister, the floor is yours.
the representative of the Right Honorable Prime Minister, the representative of Health Development Partners, the representative of World Health Organization, representative for Uganda, the heads of UN agencies who are here, the mission director, you said, all other invited guests, ladies and gentlemen. My name is Alan Muruta. I'm the acting director of public health at Ministry of Health. Substantially, I'm the commissioner epidemiology and disease surveillance, as well as public health emergencies. Allow me convey sincere apologies from the Minister of Health, as she had to accompany His Excellency the President in one of the functions currently going on. So this closing function of the JEE exercise gives me much pleasure that has come to a successful conclusion. Allow me appreciate the Office of the Prime Minister for coordinating this exercise and bringing together all MDAs, partners, private CSOs, health consumers to participate in this exercise. Working together is imperative because emergencies do not choose whom to affect. Therefore, my ministry will continue to work with the Office of the Prime Minister to mobilize other sectors to play their part in building our national health security. Although this exercise has been completed successfully, this is not the end to the means, but a step to the end, because the products of this exercise are going to facilitate in the development of our second operational plan for health security. Right Honorable Prime Minister, you may recall that your office coordinated the first JEE exercise way back in 2017. And although the head of experts advised us not to compare the two processes, allow me to say this, that for those indicators that were there in 2017, the country has made progress. As you have seen in his presentation, a number of areas had reds, which have since improved to other colors, but not red. Although we still have some reds in the new areas, but in those areas where there were reds, we have since moved. I don't need to mention them, you all saw them. So, Right Honorable Prime Minister, a country has made progress in many technical areas. Asante sana to all of you. Clap for yourselves. The GHSA 2024 set a target of 100 plus countries who have achieved demonstrated capacity in 5 technical areas, at least. I'm happy to mention that Uganda has made progress towards this, although the struggle continues. To be specific, in the area of medical countermeasures and infrastructure, Uganda is now manufacturing her own PPEs, including coveralls, masks, boots, gloves, etc. And more than 10 regional referral hospitals have well-equipped intensive care units and high dependence units with oxygen plants, and the country is in the early stages of manufacturing vaccines. The country's public health emergency management has embraced the whole of government approach, with structures spanning from the village level all the way up to the office of the president. Despite this progress, there is more work to fully comply with IHR 2005. At this moment, allow me appreciate the JEE external experts for being candid and objective in this evaluation exercise. Asanteni sana. Our national experts had very good deliberations and with this team and reached consensus on the scores that you were able to see during their presentation. The external team was also able to visit the various places to confirm some of the scores that had been proposed. And these include the health center, the points of entry, labs, EOC, NMS, so that to us to give a true picture of the feedback that we are able to receive this morning. There are lessons learned and benefited from the JEE process, like targeting our scarce resources effectively, enhancing more holistic whole government, integrated and multi-sectoral collaboration, and transparency and trust amongst public and other partners. So in conclusion, the country is going to be waiting for the report so as to allow move to the next phase of our second National Action Plan for Health Security. The country values this exercise, and because it promotes effective recommendations, I wish to assure the external team that the recommendations will be used well to benefit the people of Uganda. Thank you for your kind attention. For God and my country, signed Dr. Jane Ruth Acheng Ochero, Minister of Health. Mr. Moderator, if I have your permission, I will not allow you to invite the Prime Minister. Let me take the honor and pleasure to invite the representative of the Right Honorable Prime Minister, all right. I'm advised that there's going to be another address by another person who's going to be mentioned by the moderator. Thereafter, I'll come back to invite the Right Honorable Prime Minister. Thank you very much.
Thank you very much, Honorable Minister. One of the commonest phrases or words in this JEE has been multi-sectoral, whole of government, One Health. So allow me at this juncture to invite the representative of the Minister of Agriculture, Animal Industry and Fisheries, in the names of the Commissioner, Animal Health, Dr. Rosa Demun. Dr. Rosa Demun also happens to be the chair of the National One Health Platform.
Thank you for that opportunity. My name is Dr. Anne Rose Okuru Tademun. I'm the Commissioner in charge of Animal Health. I'm also the Acting Director in charge of Animal Resources. I am also the Chief Veterinary Officer of Uganda with regards to the World Organization for Animal Health. I'm also the chairperson or chairman of the One Health Platform of Uganda. Good afternoon, good evening, ladies and gentlemen. I address the Prime Minister's office and a representative, the Ministry of Health, the Ministry of Agriculture, Animal Industry and Fisheries, our partners, the FAO, the USAID, UNHCR, the One Health actors in this room, that means the rest of us, agencies, NGOs, individuals, but especially the evaluators. Ladies and gentlemen, I'd like to appreciate all of you for putting interest in the One Health activities, and especially the joint evaluation that we have undertaken. I keenly came here on, I think, Tuesday, and I have been here since morning to evaluate for myself also what is going on. But before I go into the depth of that, I bring you greetings from the Minister of Agriculture, Animal Industry and Fisheries, whom I represent, Honorable Frank Tumwebaze. I bring you also greetings from the rest of the ministers. We have 3 ministers and the permanent secretary, and of course the staff of the Ministry of Agriculture. Several things have been talked about joint evaluation, but what I want to add on behalf of my minister is that we have to recognize that 75% of diseases, or at least 60 to 75% of diseases that affect us as human beings are actually originating from the wildlife and also from domestic animals. Domestic animals happen to be our food. At lunch, there was meat, goats, chicken, everything, eggs. Every day you wake up and you participate in consumption of animals. Therefore, it is, to me, I think 75% of our interest should be addressing diseases that are coming from the livestock sector or from the animal sector as our priority. Because if we prioritize disease response at human level, then we are getting it wrong, and probably we are using much more resources, 75% of the resources, if you want, not usefully, because we have not addressed diseases at the animal level. So I would like to appreciate the fact that the JEE has focused on the animal sector. They've gone up to the slaughterhouses, they've gone up to wherever we get our food, wherever the food is cooked. So that to me is a very valuable exercise because it brings out the importance of the food that we eat and the value that we place that and the knowledge that we have that this food can bring us diseases. I want to bring peace to us by talking about the veterinary services. At the level of the World Organization for Animal Health, we undertake what we call performance of veterinary services, a similar exercise that has lasted for a very long time. I didn't capture the date, but it's more than 10 years in operation to, in fact, 20 years, more than 20 years in operation. We have been evaluating the veterinary services in a similar manner and in fact in the similar scores and the arrangement. Evaluation is an important aspect in our lives because when you evaluate, it helps you to score yourself like we have scored, and it helps us therefore to know how to move on and how to improve. The piece that I bring to you is that the fact that we have been running the performance of veterinary services under World Organization for Health, before it was the OIE, which is a French acronym, it has been gradually building and pushing the veterinary services to improve. What we abbreviate as PVS, or Performance of Veterinary Services, we have undertaken all the levels of the veterinary services performance. From the performance of veterinary services, we move on to the checking of the gaps. That's another stage. And then follow up on the gaps that are identified. The PVS goes ahead to ensure that they identify what areas the country has to work on, and that's where they should implement. And we have incrementally performed or undertaken to close the gaps that have been identified by the PVS. Uganda has also undertaken the laboratory performance of veterinary services. At World Organization for Animal Health, even the laboratory is assessed as an independent assessment. And not to talk about the performance per se, but the fact that Uganda has been open to performances for assessment of our performance. We are now organizing to do our performance at a specific area of the wildlife performance of veterinary services. We will apply to the World Organization for Animal Health for checking of for them to come and assess the level at which we are performing with regards to veterinary services as far as wildlife is concerned. Therefore, we are assuring this community that from the 75%, we are trying to work as hard as possible to reduce the number of diseases that move from the animal population into the human population. The challenge which has been there has been after the gaps have been identified, and I'm looking forward that the gaps that have been identified, the red areas, the pinkish or pink areas, I think they are orange areas. They are orange areas. The red and orange areas are areas that we need to follow up on. I'd like to call upon ourselves to make sure that we address those areas specifically and intentionally. That's when the assessment, the subsequent assessment will change. That has certainly been a weakness, that having identified the gaps, probably we are unable to close the gaps as quickly as possible. But incrementally, the Ministry of Agriculture, Wildlife have been closing these gaps slowly. I therefore want to close my remarks on behalf of the minister by saying that we are looking forward for a unified action to close the gaps that JEE has identified, and to thank all of us, but especially thank the evaluators for being open-minded and critical at the same time, which is going to be valuable for our nation. I say all this for God and my country. Thank you very much. Yes, I love that one. You see, chairs are nice. I'm representing the minister, and indeed I'm representing the Minister of Agriculture. And therefore, I will enjoy to take this opportunity to invite the representative of the Prime Minister to speak to us and also close this workshop. Thank you very much.
Thank you very much. But before I put on fully the gowns of the Prime Minister, let me just make a short remark as one who has been a participant in this vital activity. We've taken 5 days going through a rigorous and comprehensive exercise to ensure that we really undertake a very comprehensive assessment of the health security, to ensure that we get security of people, of not only Ugandans, but the world as a whole. And since that is the case, I would like us to note a few things as our take home. One, the power of collaboration. All what we've gone through has been a collaborative effort of the many MDAs. And you remember the Honorable Minister for Health was complaining that MDAs are not well represented in such activities. So I implore you, all members who are here, that we take this activity very serious. And when we collaborate, we can achieve more than ever in isolation. Point number 2, the resilience in the face of uncertainty. Pandemics don't give appointments. Epidemics don't give appointments. And we've seen our health systems, our health workers, our health professionals going through a lot of challenge. And these really need to be strengthened. I therefore say that each MDA at least should ensure and endeavor to ensure that we strengthen ourselves further to bolster our preparedness. 3, continual improvement. Although Dr. Shikanga is against comparative submissions, but it can't go without mention, is that each step builds on another. And therefore, we should really ensure that whatever we've acquired, we should not let go. Let us just build onto that. Point number 4 is the global solidarity. If you look at our universe, it is open and interconnected. So one country being stronger or well endowed in acquiring the capacities of the international health security is very dangerous, because it leaves pockets of sources of next emerging public health emergencies. Therefore, we should ensure that we leave nobody behind. And this appeal goes to WHO, that at least you ensure that each nation, if there is, gets such a grant that improves their capacity, ensure that they improve on their health security. Finally, the value of honesty and transparency. When Dr. Shikanga was presenting, my heart was throbbing, thinking that maybe he will bring a contrary view to his findings in the field. I would like to congratulate the government of Uganda and all of you that whatever you said was really brought back into affirmative. Thank you very much. And I just encourage you that you will take these findings and recommendations of this evaluation to heart and just translate them into the next concrete actions. I now put on the gown of the Prime Minister. I'm Dr. Ngobi Agreviansi. I work with the Office of the Prime Minister in the Prime Minister's Delivery Unit, specifically in the health thematic area. I'm bringing apologies from the office as a whole and the right Prime Minister that he had another activity that's coincided with this. There is a National Agriculture Expo ongoing. She's been moving to regions and now she's in the Masaka region, so she couldn't be with us. Otherwise, I now bring remarks in verbatim and kindly receive them. I'm now the Prime Minister. Honorable ministers who are here and their representatives, the permanent secretaries, development partners, representatives of international organizations, representative of development organizations, implementing partners, the Joint External Evaluation Mission Team, ladies and gentlemen, following the launch of the Uganda chapter of the Joint External Evaluation of the International Health Regulation of 21st September 2023 by my office, I wish to congratulate the country for having successfully conducted both the internal and the external evaluation. Special appreciation goes to the World Health Organization team, especially the Joint External Evaluators, led by Dr. Shikanga, for having led diligently and successfully the evaluation and evaluated our country during this JEE exercise. Uganda, being one of the founding members countries of the Global Health Security Agenda, and given the high risks we face from health security risks in the Great Lakes region, we have to take seriously the implementation of all capacities in the international health regulations. This week, we are informed that after 4 years of implementation of the international health regulation capacities, through the multi-sectoral implementation of the National Action Plan for Health Security, and because of the measures we had to take in tackling the devastating COVID-19 pandemic, we have made good strides in strengthening our health security capacities of the country. We also indicated that multiple public health emergencies, among others, have been managed in the Uganda region, sporadic malaria outbreaks in different parts of the country, Ebola viral disease in Mubenda and Kasanda districts, the recent cholera outbreaks in Kayunga and Namaingo districts, and we also continue to respond to other forms of disaster including and landslides, especially in Kasese and areas during the current ongoing El Nino rains. Globally, available evidence now shows that health threats and disasters are growing in number, frequency, and magnitude. The recent earthquake in North Africa and Middle East, plus the floods in Libya, amongst others, attest to these risks. Population growth has brought East Africans close to one another and close to animals, increasing the opportunity for pathogens to transmit between animals and humans. Climate change has also made it easy for diseases, vectors like mosquitoes, to cover most of the territory. Climate change particularly is a matter we have to address a lot more seriously going forward, but we will delve into that in greater detail at another opportunity. For the purpose of this concluded joint external evaluation, we must recognize many recent new and reemerging pathogens quickly spreading within and outside our borders, including, among others, COVID-19, Ebola and other hemorrhagic fevers, anthrax, yellow fever, cholera, avian influenza, Middle East respiratory syndrome, and the Zika virus, which emerged in America. Unfortunately, we must continue to be prepared to prevent, detect, and respond to the threats posed by the bioterrorism, as well as accidental release from laboratories. Today, we have concluded the joint external evaluation of the interventions we have undertaken in the 2021/2022 and 2022/2023 annual operation plan, and in the broader national action plans for health security. The interventions have been evaluated, understood, and stage stock of the country's investment in this area, and assess how effective the measures the country put in place have been in keeping Uganda and the world safe from infectious disease threats and public health emergencies. The Office of the Prime Minister has the government mandate to coordinate all ministries, departments, and agencies, and pledges to continue coordinating the implementation of IHR activity among all ministries, departments, and agencies. The Office of the Prime Minister pledges to consider incorporation of AHR activity and the National Action Plan for Health Security 2 in the next financial year budgeting framework, and looks at continuously comparing all ministries, departments, and agencies to incorporate AHR activities in their sector budget work plans. I call upon all of us here from the different sectors and organizations to strive to improve IHR capacity scores to sustainable capacity for some of the indicators in the demonstrated capacity. This is achievable since these are multi-sectoral activities across the whole of government. His Excellency the President and the National Resistance Movement government is committed to continue supporting the development of science, technology, and research, which are essential for implementation of national health security interventions. We will also continue to leverage on government priority policy interventions, such as the parish development model, to ensure national health security measures are effectively implemented at the household community, and parish level, which is consistent with the Sustainable Development goals, that is, leave no one behind objectives, as well as the requirement of the International Health Regulations 2005 of containment of diseases at source. In order to support this good cause, the Office of the Prime Minister will continue to coordinate all relevant sectors, assess, prioritize, implement, and review our actions biannually to ensure we are making stepwise progress to meeting our goals. We have successfully conducted the joint external evaluation this week from 23rd, 27th October 2023, and all sectors have an important task to conduct in the development of the National Action Plan for Health Security 2. I implore it to commit to conduct and execute it systematically and professionally through the tools and instruments available to you. Please ensure that you employ all whole of government and One Health approach when assessing the implementation of the health security activities. I wish, on behalf of government and on my own behalf, to sincerely thank all the external evaluation team, the Joint External Evaluation Country Secretariat, implementing ministries and agencies and departments, implementing partners, development partners, United Nations agencies, and all stakeholders for all the content, technical and financial support in the JEE exercise, and urge them to prepare support to develop the National Action Plan for Health Security 2. I now have the honor and privilege to close the 2023 National External Evaluation successfully conducted in Uganda between the 23rd to 27th October 2023. For God and my country, signed Right Honorable Prime Minister of Uganda, Robina Nabanja. I thank you.
Thank you very much, Chief Guest, the Right Honorable Prime Minister of Uganda. I will humbly request that the high table can actually arrange and probably stand up for a photo. The photographers will give us more directions. And as they do that, meanwhile, I'd like to thank Dr. Makumbi for having given me the opportunity to moderate this session. I've really enjoyed my job. And Dr. Makumbi, I'm asking, is there a way we can manipulate the process and we extend this JE for 1 week at least? I'm on my knees. Thank you very much.